Hi there everybody! Welcome back to my channel. This is Inday, your nursing charge. So for today's vlog, we are going to talk about what is ABC versus CAB in nursing. And of course, we're going to start after the intro. There are a lot of nursing students who are still confused on what to use in their examinations, especially if they are dealing with airway, breathing, circulation versus compression, airway, and breathing. Some of them are confused. Most of them are actually messaging me on what are they going to use, especially if the situation is like this and if the situation is like that. So, don't worry because you got the right video. I'm going to teach you on the proper usage of ABC versus CAB. And I hope that this video will going to help you in your nursing examination. And of course, you're going to ace in nursing career. But before that, please don't forget to click like, comment down below whatever you want to say, subscribe to my channel, and hit that notification bell so that you're going to be updated on whatever upload that I am going to take. So first, what is ABC in nursing or in the medical field? A means airway, B means breathing, C means circulation. So this is one of the prioritization process in nursing or in medical school. Usually, this ABC is being used especially if you are dealing with emergency cases. Actually, ABC is being used as primary assessment, and we also have the secondary assessment, which is the DEF. But we're not going to talk about that because we are going to focus on ABC. That's airway, breathing, and circulation versus CAB. CAB stands for circulation, airway, and breathing. Most of the time, that is also being used in the emergency department. So, which is which? Is it ABC or CAB? Actually, you can use them both, but depending on the scenario. So, airway, breathing, and circulation is being used if you are assessing a patient. That is actually one of the prioritization strategies in nursing examination because airway, breathing, circulation, or the ABC technique or the ABC strategy is being used as primary survey. Airway, as I've mentioned in my last vlog, is that it is the process wherein the air enters to the lungs. And breathing is the process of gas exchange in the lungs. Meanwhile, circulation is the process of blood in the body already. Airway, breathing, circulation is vital in primary assessment. This is being used in the emergency if there's already emergency situation. And of course, the medical professionals are using it especially if they're assessing trauma patients. We need to clear the airway once we are with the patient. So any obstacles that is in the airway part, we need to remove it so that there is no blockage of air entry into the lungs. Anything that you can hear that is no longer normal in that patient, remember when you are assessing the patient and if there is any abnormalities already in the airway, take note of it and report it to the physician. More so, how are we going to stabilize the airway? There are two types on stabilizing the airway actually. First is, let's see if the patient has a spinal fracture. This is being applied in trauma patients. If the patient has a spinal fracture, what is the thing that you are going to use? Is it the jaw thrust maneuver or the held tilt chin lift? If there is problem in the cervical area, let's use the jaw thrust maneuver and stabilize it. Stabilize the airway using the EC technique. EC technique is here right in your hand. EC technique. EC technique. This is the EC technique. It's being used in the jaw thrust maneuver. Remember that. What if the patient doesn't have any cervical problem or spinal problem? We can use the head tilt chin lift wherein they will going to do like this to the patient. Okay? Head, tilt, chin, lift. I'll show it to you. It's kind of weird, but I'll show it to you. Head, tilt,
chin lift. Okay, so it's like that.
I don't have a mannequin, so I'm gonna use my body.
So head, tilt, chin, lift. So that this one, or in this area, the air is entering directly to your
lungs. You got it? Usually, they are using that head tilt chin lift if they are already intubating the patient because the doctor can see right away the epiglottis. It's in this part. So that is the jaw thrust maneuver versus head tilt chin lift, and that is in the airway. The second one is breathing. How are we going to stabilize the breathing of the patient? Once the airway is already cleared, the doctors are intubating the patient. And what is the vital sign that we are going to check in that breathing? Of course, it is respiratory rate and the SpO2 of the patient, or the auto-saturation rate of the patient. So in the breathing, we can consider the mechanical ventilator of the patient or the VBM, bug valve mask. Also, endotracheal tube, LMA, and others. I'm gonna make another video about this one because it's already an emergency topic. So breathing, let's consider the gas exchange in the lungs. So we will consider mechanical ventilator, LMA, endotracheal tube, insertion or intubation, and others. The next one is circulation. In the circulation, what are the things that we are going to consider? Of course, IV access. IV access. Usually, if the patient is trauma or the patient comes to you in the emergency department and already losing a lot of blood internally or externally, we need to insert 2 large bore cannulas, and it should be near to the heart. Let's consider that, yes, we need to insert first in the distal part of the patient, but we are already referring to life-threatening situations. So, we need to insert that cannula near to the heart. Usually, we are inserting it in the brachial area here, but if this distal area are no longer useful, you can use the patient's external jugular. And usually, the external jugular insertion is being done by our doctors because they know more, or they can use the ultrasound in inserting that cannula. Here in the circulation area, we are resuscitating the patient using fluids. Most of the time, we are considering RL or the ringer lactate or normal saline, depending on the needs of the patient. Sometimes, if the patient is losing a lot of blood, the doctor is ordering ringer lactate, but depending again on the ABG analysis of the patient. I'm going to make another video about the ABG analysis, and I hope it will help you also. So that's about ABC. You need to check first for the airway. Is there an air entry to the patient? Letter B, breathing. Is the patient's vital signs like respiration or saturation, oxygen saturation of the patient is normal? And letter C, can I consider the patient's blood pressure okay? So if you can see here in A, B, C, we are also considering the vital signs of the patient. So if you can see, A, B, C is being used for assessment, primary assessment. Don't confuse yourself with the CAB. We'll go to that later. ABC, it's being used as assessment to the patient, especially in life-threatening condition. Now, let's proceed to CAB. CAB stands for compression or circulation, airway, and breathing. So if you can see, the circulation went to the top. Why? Because the American Health Association believes that if you are going to initiate compression first to the patient, there is a high rate that the patient will survive. And it's part of the chain of survival. The CAB technique is being used in ACLS, or the Advanced Cardiac Life Support Algorithm. The CAB technique is already being used by the American Health Association since 2015. They modified the algorithm. Before it was ABC, but this time it's already CAB. The CAB is actually a radical change on how are we going to approach the CPR or the cardiopulmonary resuscitation. The problem here is that what is the technique that I'm going to apply first if I can see a patient in the hallway with no pulse, no breathing, breathing. Of course, you need to assess. Assess for pulse and assess for breathing. If you can see a patient already lying down the hallway without pulse and without breathing, don't hesitate to use compression. If you can see the ABC earlier, I'm always referring to the trauma patients. So meaning to say, ABC that is being used most of the time to the traumatic patients in the ED or outside ED. And the CAB, it's being used in inpatients, especially for cardiac patients. And in applying the CAB, we need to step first with compression, and we need to make sure that there is no interruptions and we are actually following the algorithm of AHA. Once you deliver an immediate compression to the patient without any interruptions, there is a higher possibility that the blood will go to the brain, meaning to say it will help the patient to survive. For cardio patients, we are always checking for the pulse of the patient. So once the patient has no pulse, let's apply compressions. And during the compressions, usually the doctors are trying to intubate the patient and we are already stepping to the airway. And once intubated, we will put the patient into mechanical ventilator. So, if you can see, compressions first before intubation, then mechanical ventilation. CAB approach is no doubt a revolution in cardiac arrest care, but it doesn't mean to change on how are we going to approach our normal patients. While ABC is being phased out by the AHA, it is still de facto that it is being used as initial assessment, especially in non-cardiac patients. So it's vital that we know when to apply our ABC and CAB technique. So remember, ABC, usually it's being used for initial assessment or primary assessment, while CAB, it's being used for cardiac patients who are already having no pulse and no breathing. So kung titignan mo, these two mnemonics are very useful in the emergency department because once you're going to use this, you can save life. And in nursing examinations, you can use this by applying your nursing process: assessment, diagnosis, planning, intervention, and evaluation. So, ABC, it falls under assessment. CAB, it falls under interventions. So, I guess that's all for this video. Always remember for your ABC and CAB technique and know when to apply them. I guess there's nothing more that I can add on this video. Thank you so much for watching. I hope it will help you in your nursing career and in your nursing examination. Don't forget to click like, comment, and subscribe to my channel. I hope you guys enjoyed the video. Thank you so much for watching. See you again. Bye!